Hello, welcome to Teledoctor. Dr. Mtale here, Wilbrod, and I'm so happy that you could find time to listen to us today. And today I want to spend some bit of time to reflect on what is currently on our minds. As you can see, I'm sanitizing, and I hope that your sanitizer is also ready for you. And please don't ignore situations. Just going into the house, coming out, you have touched surfaces already. Just going into your car or a shop, coming out, you have touched surfaces or greeted somebody. So make sure that you sanitize and wash your hands after each activity that you think would expose you to COVID. That's the new normal, and we always start with that. And this week, I wanted to take a little more time to give an in-depth presentation or lecture on COVID-19 and some of the dynamics that we call transmission dynamics and what is happening globally, which you need to know because it impacts us here in Zambia. As you know, we have got over 95 million people with COVID globally. This number is changing, and we are, I think, approaching 100 million people with COVID globally. And in Zambia, the numbers have been increasing. In fact, if you see from last week to this week, the numbers are increasing. We are almost over 50,000 kind of cases that we have seen. And then we have seen so many people who have been admitted. Our hospitals are fighting the possibility to be overcrowded. And we have also seen, even when you just open social media, you see so many people talking about a loved one who has died. So there's really literally no one who can say they have not been affected by this COVID pandemic. And last week was one of the worst weeks that we have noticed in terms of numbers of COVID. So many people actually in Zambia got infected that week, and I think it's one of the worst, including mortality as well. And so the question that we want to ask, is this going to be the case going forward, or will we see some change or some kind of reversal in what we have observed? There are several factors that we must consider that we think can make some people vulnerable and others less vulnerable to COVID-19. So there is a study I want to show you by Williamson and others, which has shown that your age is very important. We don't see much in terms of sex distribution, but your age is important, and your obesity, kind of BMI if you like. Then we know that people with hypertension, people with diabetes are prone to complications. And this is the irony. Some people get this COVID and they don't really show the symptoms. Others get it and they get really, really serious. And then the question to you is, why do others get sicker than others? And basically what I'm explaining to you is that there are some factors that make that more likely, including having a pre-existing condition like diabetes and hypertension and obesity. There are other diseases like, for example, if you've got cancer, if you've got chronic renal disease, and if you've got asthma, these also add to the risk that your disease might become complex. And so we have to think about where we are sitting. What is our risk status? Are we obese? Are we having pre-existing conditions? So that means even the precautions we must take should be in tandem with what kind of risks we face individually and as a group. There have been also discussions on what are the symptoms that people would present with when they have got COVID. I think it's not very clear that everyone should have the same symptoms, but there are things that we know. For example, a study was done in the UK, comprising about 16,000 people. They found that the cough was one of the commonest things that people presented with, and then fever and shortness of breath. Then other things like muscle pain, nausea were less. But we have seen, like in our setup here in Zambia, people present, for example, with abdominal pain, diarrhea. They could have a fever or just a mild cough. So Others could present with very funny, maybe just feelings. Others would have just collapsed if they were not known to be having COVID, and they just die at home. And so it's very important not to blanket everything in one say until you have a fever, until you've got a cough. You could still present with something which is not a fever, but just be aware if you've been exposed and you feel funny, it could just be COVID. So just to summarize there, cough is not the only symptom. Difficult breathing is not the only symptom. There are others that can present, including diarrhea, nausea, and in our setting we can see this happening. And it's very important that you don't sit at home and just expect that until you get those known symptoms or signs. I want now to transition to testing, because this is a big discussion. Like, how do you test for COVID? So, and when do you test for COVID? So, from my understanding is that people, if they feel that they're exposed today, some of us are running straight to go and get tested. But here's the thing. If you test within the first 1 week, or 2-3 days after you get the infection, sometimes you can miss it. And that's why it's very important that at a time when you feel like you've got symptoms, you've got some signs, that's when you test for COVID. Sometimes you also, even if you don't have signs and symptoms, you need to give it time, say 5 to 7, 10 days before you test. Otherwise, if you do it too early, you miss the chance, you miss the opportunity. Either, or if you do it too late, the disease would have passed. So you need to do it very early. You don't have to do it, very early or too late, just in between, somewhere around 5 to about 10 days, 14 days, you can have yourself tested. So that's very important, so that people don't do tests that would show that they are negative when in fact they have done it too early, or negative because they have done it very late. Now there are two types of tests that can be done. So some is to look for the bug itself, for some proteins or part of the bug, which is the coronavirus, and that is PCR. It looks for the presence of that bug or its protein in your blood. Then the other one looks at the antibodies, which are your reaction or the chemicals that come after you have been exposed to COVID. And so some tests can rapidly look for that, or it will take long with PCR, but they are also rapid tests. But some tests can also look for antibodies that would show that you have been exposed. It doesn't say that you are actively sick now, but it shows that somehow the coronavirus entered your blood. And there's chance that if you look for the types of antibodies, if they call them IgM, IgG, the IgM are the ones that come much earlier. It will show that you have had recently infected, or if they're IgG, it may be that you were infected some time back. Again, even when you do vaccines, these are some of the things that they look to. Did your body produce this or it didn't? Depending on how much you produce and how long that lasts, that will determine how long you remain immunized. But also just to say that it's not clear that if people throw up these antibodies, then they are immunized. Because I think they have also seen people that since I've got COVID, then I'm out of danger. I think with the strains that we are not seeing in South Africa and coming to Zambia and also globally, it might be that you may have been infected with a different strain compared to one which is running about. So you still remain vulnerable. So precautions must apply whether you have been infected before or not. Now, there have been so much discussions on the transmissions, like what kind of masks should we wear, which ones are working and which ones are not. So basically, if the distance is very close, even when somebody's got a mask, you can transmit. And so the distance is important, but also you have to wear masks. And the types of masks are different. But also just to mention that the coronavirus is just not entering through the nose or mouth. It can enter through the eyes as well. And so that's why you've seen people wearing screens, especially if you are in very high exposure places. You may also need a screen because the corona can enter into your eyes. Okay?
Teledoctor.